to secure items for us. So again, thank you to all of our raffle sponsors. So this is it. This is our last session. So I appreciate all you guys that are still here with us. What an amazing 2 days. Let's see. Am I? Thank you guys. What a great 2 days, though. I think everybody now knows my official staff assistant last night. I think she probably took every single one of y'all's hands and went for a lap around the room in the family social. So I enjoyed the networking she did for me on my behalf. And thank you for all for giving me a little bit of a break last night. I hope everybody enjoyed the social. It was the first time we've done one of those. It looked like a great turnout, so I had fun. I hope everybody else did too. So what just an amazing 2 days that we've had. We've had leading global experts speaking about diverse SATB2 topics. We're supporting individuals with SAS across the age spectrum. We have individuals that are 2 to 3 years old to age 40, all represented here today among you all. We're supporting families of all roles, no matter what. We have grandparents, we have aunts, uncles, we have therapists, we have school teachers, we have friends. We have so many diverse people here sitting in this room, in addition to all of us as parents. Our roundtable discussions looked amazing. I didn't participate, but you guys were all engaged. I felt bad breaking them up, but what a great way to add in additional topics and talk among ourselves about us. We're the experts in our children, and we're gonna learn so much from each other. So I hope that everybody enjoyed the roundtables. The social engagements, getting to know each other, just an amazing 2 days. So thank you all for being here with us. I hope you enjoyed it. We do have one more video from one of our international charity partners I saved for today. Our association from Spain has also provided us with a video to share what they're doing in Spain.
Hello, first of all, we would like to thank you for giving us the opportunity to tell you about the activities and projects we are developing from SATB2 Spanish Association. At this moment, we have already 38 patients. Quarterly, from the Board of Directors, we send our members information about the projects and activities developed by the association. Luckily, we have a psychologist and a social worker who help us in our day-to-day. As you can see in our newsletter, the association was chosen among thousands for our project Dando Voz al SATB2, which can be translated as Giving Voice to SATB2. This ambitious project aims to provide our children with a robust communication system. The project also includes training for families and professionals. This way, they can help our children in achieving greater autonomy in the daily use of the system by themselves. During this first quarter, we have carried out many events to promote the visibility of SATB2. The Spanish Council for the Defense of Disability and Dependency organized the conference Rare Diseases Extraordinary Stories. One mom of our association took part at the conference by telling her personal experience. On the International Day of Persons with Disabilities, we participated at several radio programs trying to raise awareness of SATB2 associated syndrome. We also take part in the second roundtable, Speech Therapy in Rare Diseases, under the slogan, Establishing a Route and Adapting to the Path. In Galicia, the Claudia's Traditional Dance Day was celebrated, a festive day where the association was made visible and raffles were held, the beneficiary of which was the association itself. Also, the Spanish football team from Barcelona wanted to give us visibility and support us on Rare Disease Day. Through numerous races, football matches, championships, sales, and charity raffles, our members have raised important funds to continue financing the projects we carry out for our patients. We were also joined by important musical groups who donate as part of the earnings achieved on their concerts. During the first quarter, we have presented 9 projects to raise funds for the second edition of the project Dando Voz, Giving Voice, related to emotions and augmented and alternative communication. At the beginning of the year, we created the SATB2 cycling team. Our team have 10 riders who participate in many races throughout Spain. Thank you very much for this opportunity and your attention, and best regards from Spain.
Just a couple of reminders too on the research side. There are 2 ongoing research studies that we've been talking about all week here. The one is the blood draws will continue into this afternoon. If you have consented to that process but have not yet signed up for a blood draw, please see me immediately after so we can make sure that you are on the schedule and that gets done today. The other is the facial scan and photos. They continue this afternoon. The gentleman doing the scans, he was, I think he was actually bragging that he has a 100% success rate, even with our kids that tend to be a little fidgety and squirmy, that he has been able to make the photos happen. So I take that as a challenge. Like if you haven't gone yet because you're nervous about your kid, he's going for it, right? So there's still time to engage in study too if you're interested. There are some global research opportunities as well. The first one is the clinical guidelines, which Dr. Z talked about this morning. So I'm going to move past that. We have a video in a second to talk about that. We also have a video in a second to talk about a project in Australia on enhancing the genetic counseling experience for patients and families with SATB2. Hoping to learn more about how that diagnostic experience can be improved. And I know we talked about that yesterday in some of our shared experiences with that. This is also a reminder to enroll in the clinical registry if you've not yet done so, and if you are interested, that was what Dr. Z spoke about more this morning, and you can email Katie Bosanko. We'll leave this slide up here for a minute so that if you haven't done that, you can grab your phone and grab a picture of that email address. So again, if you've not yet done that, we would encourage you to do that. Before the videos play, one of the things that's been going through my mind as the conference wraps up is as we left the first conference in Little Rock that we went to several years ago and we went home, there were friends and family that asked us, so how did it go? And my wife and I just had a terrible time getting down to just a few words what the conference was. And one of the things that we shared with people is we said it was heavy, but it was good. That admittedly there is a lot that is heavy about being here, and it's probably going to take some time to process through that. But it was also very good because there were a lot of things that we learned and a lot of encouragement and hope for what could be for our daughter. One of the things that just sticks out to me so much is just seeing everybody with their communication devices and going home and doubling down. That was one thing that we did right away, is going home and doubling down with a communication device. And now, years later, my daughter left the session to come out and have written down, Sister Lainey, best sister ever, I love you. Like, how cool is that? And then she also wrote, Mommy is a stinky butt. So, you know, there's that too. But, you know, yeah. So hopefully there's, even despite the heavy, there can be some encouragement in that. But I know this conference and the work of this foundation has been, like, in no exaggeration, it's been life-changing for our family and for our daughter. And that is a direct result of Allison and the work that you've done. And we thank you. If you could come up, the board did come together, and the board wanted to make sure it was something you could check in your suitcase. So it's not physically large, but we wanted to get you a day at the spa to unwind and relax when you get home. So thank you very much. So with that, we have a couple videos about these research projects.
Hello, I'm Erika Stericha, the founding president of SATB2 Europe and appointed chair of the first global clinical practice guideline for SAS. So what are clinical practice guidelines? They compile existing knowledge to help healthcare professionals improve patient care. And why do we need them? For common diseases like diabetes or cancers, guidelines exist to guide diagnosis and treatment. For rare diseases like SAS, there is no such consensus on best practices. So we need these guidelines to ensure our children receive appropriate care no matter where they live. So far, we've gathered 58 experts from Europe, US, Brazil, and Australia, along with 16 parent representatives from 13 countries. And I would like to say a big thank you to all involved for volunteering in this 2-year project. This effort is co-chaired by Dr. Zarate and Dr. Osredkar and supported by European Reference Network for Rare Malformation Syndromes, Intellectual and Other Neurodevelopmental Disorders, also known as ERN-ITACA. Currently, we are identifying key clinical questions to be answered with recommendations in the guidelines. Parents' input is crucial to make this guideline relevant for our children. So please stay tuned for the online survey that will be shared with the community in the beginning of October. Thank you for your attention and future involvement. And I wish you a great time in Ohio. Bye.
Hi everyone, my name's Kavya and I'm a genetic counselor and a volunteer with the SATB2 group in Australia. We're called SATB2 Connect here, and over the past year and a bit I've been working closely with the group in Australia and New Zealand as a part of my master's research project and as a volunteer to carry out a research project to understand the genetic counselling needs and information gaps of families. What we're trying to do and what we've done is sort of highlight the experiences of families and family members who have received a diagnosis or on their path to receive a diagnosis or years after, and sort of try to understand what we can do better as a community, what resources they'd like, and just better understand how we can make the experience a lot more positive. We're wanting to extend this opportunity to the families and the community broadly, and that's why I'm here highlighting a little bit of the research that we've carried out. Our research is a little bit unique in that it is truly collaborative. We've had a researcher on our team who has lived experience with SATB2. Her name's Dalal Dawood Baumgartner. She is the principal founder of the SATB2 Connect group in Australia, and she has truly been pivotal in bringing a very different experience to the research project. So I think it is very truly collaborative, and I think we want to keep that essence going, and that's why I invite the broader community to become a part of our research and see where it takes us. I'll be reaching out to you in the next few weeks with a lot more detail around what the project entails, and I'm hoping to hear back from some of you if you'd be interested to volunteer and participate in this research. I'd just like to end by saying thank you to David and Allison for giving the opportunity to let us participate and just share our research with you. I hope you have a lovely rest of your day. Thank you so much. Bye.
So as you can see, there's so much happening in our community globally. As I shared on yesterday, we have so many international charity partners. But our work doesn't end here with the conference. We have to continue working. We have to continue expanding and building programs, expanding what we have, build new programs. We're going to continue to find more families. This is a record-breaker number of people here, and we're only going to continue to grow. So we need to continue our online and in-person events throughout the year. We are expanding our virtual support groups. We're expanding our family support programming. We're adding sibling support programming in. We're adding adult parents of adult SAS individuals support groups in. We have educational materials from recordings and webinars, other education-focused events. Those have to continue to keep growing. We have to continue to creating and disseminating topic-specific materials to support each of you. Because at the end of the day, we are the experts. Every single one of us has had to educate multiple medical professionals about our child, and it's going to continue. So we want to make that process easier. We want to make that journey easier. We want to equip everybody with information so that they can take that to their doctors and not have the same struggles that I had 10 years ago with my daughter. We're going to continue advancing research. We're going to connect with more families, and we're going to continue to expand awareness to make sure that SATB2 associated syndrome is a much more known name. Dang it, y'all. As I shared with our mission, we have 3 pillars of our program. Family support programs is one pillar, and it ranges from so much, just from the informal conversations that we have, from getting the emails of, hey, I just got the diagnosis, I have so many questions, to having so many amazing people on my board that's willing to just jump on a phone call with a brand new parent, answer their questions, because they don't know what to ask. So we just sit and listen and we talk. We provide clinic travel grants for the multidisciplinary clinic at Arkansas Children's Hospital, so we believe access to getting there is key, and we want to support as many families as we can. We have a family assistance program grant that we started in 2021. We provide grants to families to help support therapies, to buy medical equipment, to buy anything that they need that's not covered by insurance, because we know that insurance is a hard battle to fight, and they don't cover everything. We provide iPads with the Proloquo to Go app on it so that you guys can have a starter communication device, because we know that every one of our child needs a voice, and so we understand the importance of that. We have a grant that we get from the GPD Employees Foundation annually to award 3 grants. You'll see that in a follow-up email from me next week, but the applications are open. Of course, we do this family conference every 2 years. We support, this year we were able to offer conference travel grants. Family Connections, our amazing Jenna Garwood and Rachel Ward for really taking on and leading the family support side of this with our family support network, and trying to really connect everybody within their states and their regions and their areas to navigate those resources that are not easy to learn how to navigate. Of course, our next pillar is awareness. It's critical to not only just wear our but to really make sure to share our story. So we have an annual awareness day on August 22nd. I'll share more about that in a second. We do participate in the Rare Disease Day, which is the last day of February. It's a global rare disease day. We have informational sheets. We have 2 versions of those. Those have been translated into, I think, 20 different languages as well. All of that is available on our website. So we have one that you can share with your family members, therapists, school teachers, and then we have one that's targeted towards your clinicians to help them understand an easy to read informational sheet. As I shared, we have webinars. We have so many pre-recorded webinars that are still active on our YouTube channel. We have several more that are in the works to continue amazing conversations from the last 2 days, or to house speakers that we couldn't get here for various logistics reasons. So we will continue those, have those on the YouTube channel, and continue to expand our education. So Awareness Day. Why did we choose August 22nd? So the man that doesn't like attention, that's his birthday, Dr. Zarate. So we chose that because Dr. Zarate has truly done so much for our community, and this was a great way to honor not only him, but our community. So we celebrate Dr. Zarate August 22nd, and we also celebrate every single one of you in this room. So you're going to start seeing a lot more about this coming from our social medias, from the emails, from everything. So, get involved. These are great opportunities to share your story. Tag us on social media. Take this opportunity to share what getting a diagnosis means. What does being here at this conference mean? What do you wish people knew about your child, right? These are great opportunities to really share this and flood social media throughout the month of August. Contact your local media, contact your newspaper or your news station, magazine, anything like that. Anybody that's going to listen, just knock on their door and keep talking and share our story, because we need to highlight the amazing community we have. We need to highlight your amazing children, the amazing parents that we have, and really help to make sure that everybody understands that our kids are just a little bit different, right? But once you sit down and you're willing to listen, I always say, as long as you're willing to listen to what my daughter is saying with her facial expressions, you can understand everything she's saying. So we're excited to be offering or to continue to be participating in our annual awareness day. We do throughout the month of August. All money raised during August is earmarked towards research. And I'm excited to announce that we have a $10,000 anonymous matching gift for research throughout the month of August. So every dollar raised will get matched dollar for $10,000. And finally, our third pillar of our mission is research. So as we've shared, in the past, we have our annual research grant program. We have research tool distribution. We have the mouse models, different animal models. We have the iPSC stem cells that's in our biobank housed by Dr. Fish. Those stem cells were created because of you guys. You guys made that reality. We saw the need. I came to our community and we fundraised $80,000 to create 4 control lines and 4 SATB2 lines. So those are, I know as Dr. already shared in his slide, those have been requested. Those are, out in different research studies throughout with multiple researchers. Of course, the clinical registry, which is housed at Arkansas Children's Hospital, we encourage you to participate in that if you're not already enrolled. As a foundation, we have the Medical and Scientific Advisory Board. We continue to foster research connections and collaborations. We're active participants with several rare disease groups such as Combined Brain, Global Genes, and NORD, the National Organization for Rare Disease. So those are all amazing resources. If you haven't signed up for their emails, sign up for those. There's so many great resources that we can all participate in. Webinars, mental health webinars for being a rare disease parent, to learning about research and how to get involved in a lot of different areas. So there's amazing things happening in the rare disease world. So what's next, right? So the next few years, we're going to continue to grow. Genetic testing is becoming accessible to so many more. It used to average that we would get 20 new families a year to 50 new families. We're over 100 new families on average a year, right? So that's just going to exponentially grow. And so with that growth, our organization needs to grow. And in order to grow, I need all of you to help. When I got Caitlin's diagnosis 10 years ago, there was 20 people. 20 people. That's just this little section right over here, right? This was it. And so it's so amazing to see this, to see that there's 57 SATB2 individuals here today with us. And so in order to continue to grow, as I shared, we need more volunteers to leverage the expertise that each of you have. I've learned that there's so much knowledge that you guys have, so much expertise that would be a wonderful asset to us as an organization. We have to also transition from being an organization of all volunteers to hiring a professional staff. That is right. We are all 100% volunteers, including myself. So in order to really grow, we have to grow and we have to take that next step as an organization as well. And it all takes fundraising dollars. So fundraising, we have to continue to hone and refine and pivot our long-term strategy. And then in the most immediate future, we have to focus on our Awareness Day. So this is the reality of where we are. So our fundraising over the last 5 years, I put in 2019 because I wanted you guys to see that was the year that we did the stem cell fundraising. So, you know, as I shared, that was approximately $80,000 that was raised. It was a banner year for us. 2020, of course, we all know COVID, and we have steadily declined. So last year in 2023, we raised a little over $71,000. As I just shared in the last slide, your full board of directors is all volunteers. We were able to, this past year, hire our first administrative assistant who only works, and it's a very part-time position. It's about 10 hours a week. That was our amazing Sunny Curl that I think many of you guys interacted with. But as the president, I do not receive any compensation, which allows me to dedicate more of our funds to our mission and our programs. Most of our expenses annually are in line with our revenue, which means that we have to be increasingly conservative with our programs. Our general operating costs are very low. This organization is run out of my house. Every single person on the board that sits with me is also virtual. We keep our costs as low as possible. Transition into upcoming events. As I shared, there's just so much that's happening. We've put this sheet of paper on everybody's table, so hopefully you're able to grab one. I'll send it out as well. We're really ramping up, as I mentioned, all the virtual support groups that we have. If you're interested in becoming a family support network leader, we have an additional training coming up on July 28th, but we're launching the single parent / caregiver support group. We have our general support group to discuss behaviors, sibling support groups. We're working to launch the adult. So stay tuned on your email. Make sure we're not going into your junk folders because there's so much happening. As I mentioned, the iPad for Communications grant is now officially open so that we can award 3 iPads with the Proliquo To Go app. So those applications will be open through August 15th. And then our so there's so much that we have to do, and it's kind of strange to think, right? But in a couple of months, I have to start working on the next conference in 2 years, right? It's overwhelming, it never stops, right? But there'll be a detailed email coming in the next week to 2 weeks with a post-conference survey. Everything that we do is developed based on feedback from the community. So, as I think David shared yesterday, we could all sit here as board members and say, well, this issue really affects me. I'm sleep deprived, right? So we should put everything and every topic into sleep, right? But we can't do that. So we look to you guys to tell us, where do you want to be? What's important in a site? What's important in a hotel, right? What do you want to hear in the agenda? And that's how all of these topics come about. It's based on surveying you guys, hearing what works, hearing what we should add in, getting you guys involved to help us plan those programs, find those speakers. But it's all developed on each of you guys. So we work hard to offset the costs of our families to make this affordable through fundraising. Our revenue from registrations and sponsorships, oh no, my total did not appear in that slide. So our revenue from sponsorships and registration, I believe, was around $40,000. We offset approximately $25,000 of that and the additional costs. So, we did have to raise registration rates, but we tried to not raise it too much to outprice people to be able to come here. So but we work hard annually to raise those dollars. So the additional revenue came out of our general fund. And so our board is not just me up here. We have an amazing team, so I'd really like to take the opportunity for my board of directors to come and get the round of applause that they deserve up front with me. So we're missing a few. But as y'all all know David Bright now as the vice president. We have Mariana Chu, which is our first international representative from Brazil and has been amazing. Jenna Garwood, Heather Green, who is not a SATB2 parent, but serves as our treasurer and an amazing advocate with her nonprofit experience. Julie Hamburg, who is parents to Lila, who's not able to be here today. Bill Regan, our secretary, who unfortunately had to leave slightly early today, but you guys definitely saw him around yesterday with Lindsay, Jonathan Riva, and Rachel Ward. So this entire team is not just me. I can't do all of this, so you guys need to give this group a big round of applause for me. Also, to thank all of our sponsors for putting on this conference. I also need to take a quick moment to pause from this slide. I can't do this by myself. I wouldn't be able to do this if it weren't for my amazing husband, Matt, and my son, Caden, who is over there in the Donald Duck hat. But the two of them have supported me throughout this entire process, so thank you, Matt. And so all of this was made possible from this list of sponsors. So the Game Changers, myself and Matt Kaczenski, our champions, AbleNet and Tradition, which is the Big T Foundation. Session sponsors, Heather and David Bright, Julie and Eric Hamburg, the Abapraxia, and the Prompt Institute. We have leaders, sponsors of Terry and Bill Regan, Red Bag Media, Red Oak Counseling, Ultra GeneX, and 4Imprint. So before I get to these two slides, I'm going to do a couple quick housekeeping items. The recording access from day one did not work quite as planned. We have a solution though. So on day one in each of the sessions, our team over here has added a link to a Google Drive so you could go and click each of those videos from day one. For day two videos, all of today, they will show up as a recording in the Zoom Events platform. So you'll just have to, for day one, go into each session. You'll see in the description a link to a Google Drive. They have currently loaded some of the files and we're going to continue to work on some editing, but day one videos are there and there will be some further edits in the next few days to a week. Let's see, tag us on social media, of course. I'm trying to limit how much I'm shipping home. So there is some stuff outside of the registration area, toys and games and bubbles. So please take those for you guys as well. But we need you. We need you in all areas. There's so much to do, as I've shared, from fundraising to research to communications, family support, finance, awareness day planning, fundraising events, conference planning. The sky's the limit. It really all comes down to resources. We need time, talent, and dollars. And so I'm going to end on this quote. Never doubt that a small group of thoughtful, committed citizens can change the world. In fact, it's the only thing that ever has. And so I charge each of you to help me continue to change our world. Thank you. I guess I should have technically allowed some Q&A. Does anybody have any questions? Well, y'all guys are easy. All right. All right. Well, thank you guys for an amazing 2 days.